Hi, my name is Pamela Greenberg, and I am the People Program Manager at HackerOne. And this is my talk about cognitive behavioral basics for uncertain times, some tips and tricks and strategies for managing stress and anxiety and what's going on in the world today. And this is something we're offering as part of Mental Health Awareness Month for May 2020. So let's jump in. So today I want to talk about what is CBT. What are the strategies and techniques, as well as the theory that make it up, and then hopefully give some useful tips and tools that you might be able to use for managing the stress of the world situation right now. But before we do that, let me take a moment to introduce myself and tell you how I got to be here. As I mentioned, my name is Pamela, and I'm currently employed at HackerOne. But prior to that, I had a whole career as a psychotherapist. So I got my master's degree in counseling psychology, and I worked as a clinician for a little under 10 years. And I worked in inpatient adult psychiatric hospitals. I worked in nonprofit community mental health, both with foster kids and at-risk youth, as well as with folks experiencing psychotic disorders. So diagnoses like schizophrenia and schizoaffective disorder. And I worked primarily using cognitive behavioral therapy in those roles, and also being a trainer and supervisor to other clinicians for using CBT specifically for psychosis. But I've been now with HackerOne for about a year. And more importantly, I should introduce Chip. So Chip is a toy poodle, or as I call him, a therapoodle, because being around Chip is fairly therapeutic. He has been with HackerOne also for about a year on the employee success team, probably far more successfully than me. And I wanted to introduce him because he generally sits in my lap, whether I'm working from my kitchen or whether I'm working at the office. And in case he pops his little head up during the talk, I thought you should know who he was. So that's me and Chip. And let's dive into what is CBT, or cognitive behavioral therapy. So CBT is an evidence-based practice, and what that means is that it's been well researched. There's a lot of data about how well it works. It's most well known for being used in treating depression or anxiety, but it's actually been researched and can be fairly effective for all of these diagnoses and others, I'm sure. And as I'd mentioned, I myself have a background in using CBT for work with folks with a diagnosis of schizophrenia. In general, CBT helps people to identify and evaluate and hopefully change their thinking and thoughts, thinking and behavior patterns that may be not that helpful. My kind of elevator pitch about CBT is that it's the radical idea that what we think affects how we feel and what we do. So let's dig in a little further. So CBT. C is cognitive, and that's just our fancy way for saying thoughts. B is behavior for actions. And T. T is a little tricky in this circumstance because even though I used to be a therapist, I'm not anymore, and this presentation isn't meant to be therapy. So for our purposes, we can think about therapy as change, since that's often what people are seeking when they go for therapy. So cognitive, so our thoughts, our actions, and changing. But there's another piece in here too about our feelings. It's often our feelings that are causing us the distress and making us want to change. So this is the triangle that's sort of at the heart of CBT, and it's about our thoughts, our feelings, and our behaviors and how they're all connected. And if I were to draw arrows kind of around this triangle, they would go in every direction because all of these things have the capacity to impact each other. So our feelings, how we feel about something might change what we do, how we think can change how we feel, what we do might change how we think. So it goes in every direction. And just to be even more specific, when I say thoughts, that can be our ideas, it can be our beliefs, our attitudes, that can be about ourselves, about other people, or just about the world at large. And our behaviors, those are our actions and our reactions. And our feelings could be our emotional states, but also they can be the physical sensations that we have in our bodies. All of this is generally happening inside of us, although our behaviors, of course, can be external as well. But we don't exist in a vacuum, right? We're influenced and experiencing the world in general and everything that's going on around us and happening to us. So all of that can come into play as well. So that's sort of a visual of how all of these pieces might come together. So now let's talk a little bit more about the difference between thoughts and feelings, because it may seem simple, but it can actually be a little bit tricky, especially at first. So especially in English and in America and possibly in other languages and other locations also, we start a sentence with I feel, but then finish it up by actually saying more like a thought than a feeling. So it can get a little bit confusing. So in this list, pop quiz, which of these are really feelings and which ones are thoughts masquerading as feelings? If you said I feel scared and I feel delighted are feelings, then you're right. Those are the feelings in this list. So what are these other ones? Well, they're probably more thoughts that have feelings attached, and we can kind of dissect that a little bit. One thing I want to point out is when we say I feel like or that usually is a good indication that we're going to be moving into more of a thought territory than really expressing a feeling, even though we said I feel to start. So let's talk about it. I feel like you should be nicer. What are we really saying here? If we were going to turn that into a feeling, it might be something like I feel hurt, or I feel sad, or even I feel angry because I thought you weren't being nice. So we might just say, I think you should be nicer. Or if we're going to try and uncover what the feeling is, the feeling might be something like hurt, sad, or angry. How about I feel that this is unfair? Well, if something's unfair, you might feel frustrated. So you might say, I feel frustrated. And again, it's because I think that this is unfair. So thoughts and feelings, as I mentioned, are really connected. And sometimes it's a little tricky to tease them apart, but we'll keep trying to give examples. So now that we know how this all comes together with our events and our thoughts and our feelings and our behaviors all happening and connected to each other, let's take an example so we can see how this plays out. And this example will be just kind of general, and we'll get into examples that are more related to the pandemic and the world situation in a little bit. So let's imagine starting a new job or a new school. Hopefully that's an event that most of us can relate to. So when that happens, maybe before our first day at a new school or a new job, we might be feeling lots of different things, but let's imagine a scenario where we're really excited. Hopefully that's something you can relate to, that it might be a really exciting experience to start something new. So if we're feeling really excited before our first day, when we show up on that first day, we might be really outgoing and introduce ourselves and meet people and learn things and ask questions and just kind of generally have a really good first day. But there's another way that this can go too. Actually, there's many ways that this can go, but let's play it out one more way. So instead of being excited, maybe we're feeling more nervous or anxious about our first day. That's also a pretty normal way to feel. If that's the case, we might have a really different day. So rather than being outgoing and meeting lots of people, we might be a bit more shy, maybe don't introduce ourselves as readily, and maybe we don't ask our questions and just kind of generally have a harder first day. Hopefully both of these are kind of relatable. Maybe you yourself have experienced both of them. So then my question is, why? What makes us have one versus the other experience? And the answer, I think, has to do with what's missing from here. So we have our event, and we have our feeling, and we have our behaviors, but we left out the thoughts. So if we go back and put the thoughts in, if we imagine feeling excited before our first day, we might be telling ourselves in our head something like, I'm so ready for this, it's going to be great. And even if I don't know all of the things, I'm going to learn and figure it out, and I'm prepared, and I'm going to do well. On the flip side, if we tell ourselves things like, I don't belong, maybe they shouldn't have hired me, or I'm not going to have a good experience, I don't know what I'm doing, that's probably going to really feed into our nervous feelings and lead us to have that kind of harder day. So I want to just make the point here that the thoughts, just the way that we think, the same person can be having the same experience, and maybe you've experienced, like, sometimes before a first day you're excited and sometimes you're nervous. It's really about the thoughts that can make such a big difference. So it isn't necessarily just the things that happen to us, but really the way that we interpret and make sense of them and think about them that can cause us our feelings, and in particular can cause us our distress, which we might want to fix. So that's the sort of theoretical underpinnings of CBT. Let's switch gears now and talk a little bit more about the nuts and bolts of what makes up a CBT treatment. So before we do that, I want to do just a little thought experiment. And if you can imagine the last time that you felt really stressed about something, and I'm sure we all have to dig way back into the vault to think about something, or maybe you have something a little more recent. But think about some time where you were feeling really, really stressed, and imagine what that was about. And it just, really caused you to tense up and freak out. Now imagine, and I'm sure none of us have friends or family members or other well-meaning people who would do this, but imagine a person who just said to you, hey, relax. Would that help? Would all of your nervous and scared and upset feelings go away? Probably not, right? So even though it is the feeling that we might be complaining about or that might be causing us trouble, generally if someone just tells us to make that feeling go away, it doesn't work very well, which is why the importance of that triangle and really acting on the thoughts and the behaviors is how we get our effect in CBT. So let's look at the structure and the components of a CBT therapy session or a course of treatment. So it usually includes psychoeducation, which is just our fancy way of saying education about psychology. So really all of the things we just talked about, that triangle and the way that the example plays out and how all the pieces fit together, that's one form of psychoeducation, and most CBT would include some version of that. It also is big on homework and worksheets and acronyms and ways for people to kind of remember things, because it's about making changes. And in order for us to do that, it takes practice and repetition, and making things easy to remember and easy to access is a good way of achieving change. My favorite part about CBT is that it takes kind of an experimental and scientific approach. So you get to try lots of different things and record the results and see what works. And so it can have a reputation for being kind of structured and rigid, and certainly there's elements of that. But I actually think it also can be very flexible, because every person is different and needs different things. And it's by trying out different things for yourself that you'll find out what the solutions that work for you really are. So in these two boxes with the thoughts and behaviors, those are just examples of some of the kinds of things and activities that a CBT therapist might give as homework or as exercises for someone to try. There's also this whole third wave of CBT with things like dialectical behavioral therapy and acceptance commitment therapy and others that includes a piece of mindfulness too. So all of the same thoughts and behaviors and feelings work, and also potentially deep breathing or other exercises to bring in mindfulness. So one of my favorite things in CBT is calling out the different ways that our thoughts can have errors in them. So this is some common thinking mistakes, and we all do them. So if we look through, let's pick out a couple. So prediction. So when we think to ourselves, oh, even before our first day, when we think this is going to go really badly, well, that's a little bit of predicting, right? Looking into the future when probably none of us really know how anything's going to turn out. We're just guessing. Or compare and despair. This is the reason that I got off of Facebook, is because it was too hard to see all these other people having these incredible lives and feeling like by comparison I was downplaying the good things in my life, or not noticing them at all maybe. And that's actually mental filter, is only noticing the bad things and tuning out the good ones. So all of these things are really, really common. So common, in fact, that we have names for them. And so I found it really freeing myself just to learn that, because sometimes just having a name for something is a big important step in changing it or feeling less trapped by it. So teaching people about these different cognitive distortions or thinking mistakes is one piece that can be really helpful in CBT. And then I said that worksheets are a big thing. So I'm going to show you a couple of examples of what that might look like. So here's a pretty simple worksheet where it's just ABC. Again, easy to remember so people can learn and train themselves to try this new thing. A is the activating event, whatever happened. B is beliefs, that's our thoughts. And C is consequences, which could be our feelings, could be our behaviors, maybe both. And just getting into the habit of writing these things down and looking for the relationship between them, similar to how we did with our first day of work or school example. Another way to do this, here's a worksheet that has a thought record that has a few more columns. So again, what's going on? How did I feel? What did I think? What did I do? And then what else could I have done? So it's another column here to add in some ideas about what you might want to do for the future, or what you might want to do differently next time. We can also use CBT for our mood. So this one is more about people who experience highs and lows in their mood and how they can notice what those differences are and maybe make a plan to get ahead of it. Because when it's sometimes in the moment, it's hard to think of things. So if we can look in advance and plan out our behavior and our choices, that can be really helpful. This worksheet was one that I had kind of forgotten about from my clinical days, but when I came across it, I thought, my gosh, this is so appropriate for the world we're in right now. Mm. And this is maybe more in that third wave CBT, bringing in some of the mindfulness and deep breathing and that kind of work. But this is about changing our expectations, that if we have expectations for how great something's going to be, and then if it's not that great, we're going to be disappointed. And so if we change our expectations, we can also change that feeling of disappointed. And I thought this was so appropriate for right now, because all of us have had to change our expectations about our jobs and about our lives and the way that we conduct them, about how close we can get to other people, or what it's like to leave the house. And I thought, we can't change all of those things, but if we can learn to change over our expectation of what our life should be, that can make a real difference. All of these worksheets are on a website, this wonderful British website, that there's going to be a blog post accompanying this video. So I'll be sure to include all of the resources there if you want to dig into to these things with a little more detail. So now I want to switch gears and talk about how do we use some of these CBT techniques and strategies for what's going on right now. And when I say right now, maybe we should spend a moment thinking about that. So to me, the feeling that's going on most in the world these days is anxiety. And, there's some really good reasons to be anxious right now. There's uncertainty, and human minds do not like uncertainty. We would rather fill in the blank even with something bad, just to have more certainty than to live with uncertainty. That's harder for us. And also, there are real risks in the world right now. So anxiety can be a very healthy response to risks. In fact, I'm going to give you kind of an equation for how we can define what anxiety is. So anxiety is the overestimation of risk plus the underestimation of our capacity to handle the risk. So thinking that things are going to be worse or more dangerous than they really are, and believing that our ability to deal with things is probably not very good and maybe worse than it actually is. Now, as I said, the world right now is giving us reason to be anxious. There are real risks. And actually, a certain degree of anxiety is helpful. It's what's going to make us wash our hands or put on a mask and keep our distance from other people. It's healthy to have some anxiety. It's when it gets to the point where our anxiety is so big that it can get in the way of living our lives, that's where it's problematic. And that's kind of what I wanted to see if I could help with some CBT techniques. But I don't want to invalidate anybody's anxiety. It's totally normal and understandable to be anxious right now. And in fact, it's pretty healthy to have some anxiety because it spurs us to action. But in general, if things are overboard, we can get better at estimating so that we can be a little bit more in control and do the things in our lives that will give us more enjoyment and just more peace of mind. So I chose 3 techniques to focus on, which I think are some pretty basic and hopefully helpful techniques for anxiety and the world that we're living in right now. There are many, many others, and this might be a starting off point for you. But again, as I mentioned, there'll be resources included in the blog, so you can look and try lots of other things as well. This is just just things I thought could be helpful. So let's start with our thought technique. Check it, catch it, check it, change it. The 3 C's. Again, easy to remember. Catch it, check it, change it. Has kind of a ring to it. That's a very CBT thing. So in this case, the it is the thought. Catching them can actually be a little bit harder than you might think. And the reason for that is that we're thinking all the time, but we're not necessarily thinking about our own thinking. It can be a little bit awkward to sort of turn it on ourselves in that way, and takes a little bit of practice. So I have some suggestions, recommendations for how to get better at that. Number 1, even though I said before, if someone just said to you, relax, and tried to act on the feeling, it would be probably not the right move. Our feelings are actually super helpful flags that get waved that point us towards like, oh, this is one of those moments where maybe I'm having a thought I should look into. So think about what it feels like in your body when you're anxious. Maybe you feel muscle tension, jaw clenching, that kind of thing. Maybe you notice your heart rate increasing and maybe even palpitations or a tightness in your chest, which I know is a little extra scary right now, since that can also be a symptom of the coronavirus, is that tightness in your chest or difficulty breathing. Maybe for you, you have stomach issues when you feel anxious. So everybody feels it in different ways, but usually we know what it feels like. So when you feel that, that's kind of your body, your mind waving the flag of like, hey, it's time to look for and try and catch that thought. So notice the feeling of, I'm feeling really tense and anxious, then pull out your trusty journal. I highly, highly recommend developing a journaling habit, especially as you're learning these skills. Again, it can be a little bit awkward. And so getting it out of your head and onto paper can be super helpful and clarifying. So you don't have to have great handwriting and you don't have to have any kind of like special training or technique for this, just really writing things down or using your computer or your phone, just to get into the habit of recording things can be very helpful. And then finally, when we're catching our thought, we want to make sure we're finding the right thought, which we'll call the hot thought. Again, catchy names for things in CBT to help remember them. So in order to get to the hot thought, we want to kind of drill down. And as I mentioned, we're having lots of thoughts all the time. So it might not be the first thought that comes to us. We might have to kind of dig in to find the right one. So let's do an example together. Let's imagine something we're feeling anxious, right? That's what we've been talking about. So that's our flag waving, and we pull out our journal and we write down feelings, anxious and scared. Then we're going to back up and say, well, what was happening around me? Like, what was going on? Did I do something or did something happen to me? And in this case, in our example, we're going to say, I was just watching the news, because that's something that I know makes people feel a bit more anxious right now. So then here's where our rubber meets the road, catching the thought. So, okay, I know I'm feeling anxious and I know I was just watching the news. What kinds of thoughts might I be having? So you might start with just like, everything is falling apart. I know I have had that thought before when reading or seeing the news. But then we're going to do our drill down and looking for that hot thought. So we're going to ask ourselves some questions. We're going to say, well, what does that mean about me? Or what am I worried will happen? And through asking ourselves those questions, we're going to get to some other thoughts. So maybe what it means is like, I can't take it. I can't take another month in lockdown, or I can't take the worry that I might get sick. Or it might mean I'm worried things are never going to go back to normal, that the life as I knew it is totally over. So another way we can confirm which of these is the hot thought, because we might have kind of a reaction to all of these thoughts. They might all be contributing to our anxiety. We can do a little rating. So a kind of quick and dirty rating, just ask ourselves the percentage. So 0 to 100, how anxious does each of these thoughts make me feel? And if we just kind of, doesn't have to be scientific, obviously you don't have like a little meter on you that tells you how anxious you are, but just kind of taking a guess, you can figure out how anxious you're feeling, which will tell you, boom, that's probably our hot thought if it's giving us that 90% response. So we have caught our thought, we've got it in its, where we can observe it a bit, written it in our journal. Now let's move on to checking it. So checking it is about figuring out if this is a kind of thought we want to keep and keep using, or whether maybe this is one of those thoughts we want to change out for something else. So I've got a quick smell test for thoughts. Is it accurate and is it helpful? And it has to be both. So let's think through this. If we take our example where we're watching the news and we start to feel anxious, and we realize it's because we're thinking things are never going to go back to normal. Let's do the smell test. Is that accurate? It's a little bit tricky. It's a little hard to know for this one, because I have some follow-up questions like, what is normal and how long do we have? Never is a long time. So I don't know I can actually answer that one. It's a little hard to say whether that's accurate or not. There might be parts of it that are, but we would have to get more detail to really know for sure. Is it helpful? And in this case, what I mean by helpful is, does it make us feel better and able to live our lives, or is it making our anxiety go so far up that it's interfering with our life? And in this case, if it was giving us that 90% anxiety, I would say it's probably not a very helpful thought. And keep in mind, there are some thoughts that are helpful that are not accurate. So everything is great, might make you feel better, but might not actually be true. Likewise, there are thoughts that are accurate that are really not helpful. Maybe thinking a lot about how many people are sick is true and accurate, but if fixating on that is giving you anxiety, it might not be helpful. So that's why it really has to be both. In this case, because it didn't pass our helpful test, even though we don't have a final answer on accurate, it didn't pass our smell test. So we can move on to changing it. So I brought back our cognitive mistakes, kind of our thinking bingo card, someone called it, and I thought that was great. So we can kind of look over our thinking bingo card and see, is my thinking going kind of off the rails in any of these particular directions? And we have other questions here I've put in to ask yourself, like, am I overreacting? Am I missing something? What would I tell my best friend is one of my favorite questions when I'm changing a thought. Is like, usually we're nicer to other people than we are to ourselves in our own minds. So that's one that can really unlock a different way of thinking. In this case, I think there's probably some prediction here since we're saying what we think is going to happen in the future. And I think there's also some catastrophizing, like kind of imagining the worst case scenario here. So before we go and put our new thought in, I have one more caveat to add in. And that is that our automatic negative thoughts, those ones that kind of pop up right away or maybe are going in our monologue all the time, are bumper stickers. They're fast, they're just a few words, they're easy to remember. Our new thoughts that we're working on that pass that smell test, they're more balanced and helpful and accurate. They're more like Academy Award speeches. They maybe go on and on. We're going to be trading out like a few words for a few paragraphs. So it can feel a little bit daunting or awkward. I just want to kind of name and normalize that. It does get easier with time, but especially at the beginning, it can feel like, oh, it just goes on and on. But if we think about it, it makes sense. Like if we're going to give a thought that's really accurate and helpful in painting a whole picture, it's probably going to be a bit more involved and have more words. So let's take our example again. Here we are. Our things will never go back to normal thought. And if we try and put a new thought in, here's what I came up with. And there are many, many right possible answers that work for different people. But what I said was, no one knows exactly what will come next, and it probably doesn't help me to be predicting. Things may not be exactly the same as they were before, but they also won't stay like this forever. So it may be helpful for my anxiety to remember that even though it might not go exactly back to normal, I'm not going to be stuck in my apartment totally alone forever. That's not very likely to happen. For other people, it might be helpful to think back to something else difficult that you went through, and you might want to give a new thought that's about more like, yes, I'm going through a hard time and I don't know with the future and that's scary, but I've been through other hard times and I know that I will get through it, whatever the new normal ends up being. So there's many ways to do this, and your mileage may vary, so it's helpful to practice and try what works for you. And then our final closing the loop here is, once we have our new thought, we try it and we ask ourselves, okay, I was 90% anxious when I thought things are never going to go back to normal. How anxious am I with this thought? And the goal is not to get to zero, because remember, we still need a little bit of anxiety to spur us to wash our hands and be careful and thoughtful. But if it goes down a little bit, that's a good sign. So if we're making a move in that direction, that tells us we're on the right track. So that's catch it, check it, change it. Again, it takes some practice, but I don't think it takes too long to get good at this. So hopefully you can give it a shot. So let's switch gears now and talk a little bit about some behavioral techniques. So we talked about thinking and how to catch and check and change our thoughts. There's also ways that we can help change our behavior. A lot of people have been exposed to different kinds of breathing exercises. Sometimes they call it diaphragmatic breathing, or abdominal breathing, relaxation breathing. There's lots of names for it. But I'm just going to teach one kind of simple technique and tell you why I think it's useful for acute anxiety. Sometimes when we are in the moment and gripped by our anxious thoughts, we can't even grab our journal and try and change them because it's too overwhelming. Our body might be in fight or flight mode. So by starting with the breathing, it can actually change our behavior. Sometimes we hyperventilate a little bit when we're anxious, and focusing on our breathing and slowing it down can get us back to a mental state where maybe we then can pull out the journal and do the work we just tried. So if we sit kind of straight up with our shoulders back and our feet flat on the floor, it can help to put one hand on your chest and one hand like really low, can't see, really low down on your belly, kind of near your belly button or underneath it even. And you can imagine a balloon inside your abdomen, inside your whole belly. And when you breathe in through your nose slowly, you imagine that the balloon expands low down. And so the hand on your chest won't move. Only the hand on your belly will go in and out as you expand and contract that balloon. So if we take a deep inhale through our nose and imagine the balloon expanding as you do that and inflating. And then when you breathe out through your nose, the balloon deflates and shrinks down. doing that just a few times can interrupt the fight or flight process, and can be really effective in reducing that anxious feeling. So it can reduce your heart rate, reduce your blood pressure, and it's even been shown to lower the levels of cortisol in our body. And cortisol is the stress hormone that goes up when we are experiencing either acute or chronic stress. So the nice thing about this technique is you can do it anywhere. You always have your lungs with you. Nobody really knows what you're doing, so you're not drawing attention to yourself if you're feeling a little shy about it. And it can be really effective and pretty quick. So really just taking a few deep, slow breaths can reset everything. So that's that. I have one other behavioral technique to share, which is less for acute anxiety and more about like, how do we plan our behaviors and deal with the world right now in our lockdown situation and everything that's going on in a way that will still help us. So this is an ACE log. And I was thinking about this one because I'd come across this graphic on the internet, which I thought was so cute with the little fox and just talking about like, yeah, the things we can control and the things we can't. And that feels so important to think about right now. And our behavior generally is something that we can control, but maybe we don't always know how or what things are going to be the best for us to change or to do more of. So an ACE log, ACE stands for achievement, closeness, and enjoyment. And it's a really, really simple way of figuring out what behaviors are doing what for us. So the way it works is you would just kind of write down day and time, what you did. It can be very simple. And then you're going to give a 0 through 10 score for your A, achievement, C, closeness, and E, enjoyment. So let's say I cleaned my room on Saturday and it was like a 9 for my achievement. Like I felt pretty accomplished at the end of that. Closeness, I did it by myself, so maybe I wasn't feeling very close. And enjoyment, well, I'm glad it's done now. I enjoy my clean room, but maybe I didn't enjoy it so much while I was doing it. So that will kind of give you a picture. The goal here is not that you get 10 out of 10 on everything, but it's more about noticing what your patterns are, what's working and not working. So if you kind of just keep going and fill these things in, then you can look at it and say, oh, wow, you know, when I was reading the news for an hour on Monday, that was not doing anything for me. Maybe I don't want to do that as much. You can also look at patterns and say, wow, you know, I'm getting a good amount of achievement and enjoyment. You know, I see running and cleaning my room and playing video games. They all gave me, you know, some version of enjoyment or achievement, but my closeness column is kind of sad right now. So that might give you an indication that it's time to do some activity that you think is going to give you a better read there. So maybe the next day you're going to call grandma and that's going to give you some closeness points. We all need all of these things. We need to feel a sense of achievement. We need to feel close to other people. Even as we socially distance, we still need emotional closeness. And we need to enjoy things in life. So they may not be the same things that we used to do that gave us these achievement and closeness and enjoyment, but it's important that we spend some time thinking about what those new things are and how we can still have all of those needs met, even as the world around us is different. So those are the behavioral techniques, our deep breathing and our ACE log. So takeaways. CBT is not magic. I think it's really useful, and I hope you'll find parts of it useful too if you try some of it out. And the truth is, the world is different than it used to be, and there's a lot of difficulty, and having emotions in reaction to that is totally valid and normal. And my job here is not to try and teach you how to erase your emotions or to, you know, make them stop. This is about, again, when our emotions, and particularly maybe our worry or anxiety, are so big that they might be preventing us from having the kind of life we want to have. There are techniques that can give us more choices and more ability to feel okay again. My recommendations are: try stuff. It's going to be different for every person. It's not one size fits all solutions, and what works for you might not work for your friend or your sibling or anybody else. So figure out what it is that's good for you. And I recommend doing that by taking that kind of experimental approach. And good experimenters tend to write things down because it can be hard to remember the details and you want to capture it as it's happening. And if you do that, the ideal goal here is that you'll end up with some tools. And having tools is crucial when we want to be making sure we're dealing with all the different things that come up in our lives, whether we're in lockdown or not. So that's really what I hope you can take from this talk today. There are other resources, and as I mentioned, I will share the website where those worksheets came from, and some other resources that are available. There's lots and lots of really great stuff out on the internet, and many good books and workbooks out there, but I'll be sure to put all of those into our blog. And I just want to say one more thing about the stress that everyone's under right now. You know, if your stress is such that you're worried that you can't take it, or if someone that you know is worried that they might harm themselves or seek to end their own life because of the strain that they're under right now, please know that there still is help available through the phone, through video chat, through texting, and that's help available all over the world. And again, I'll share resources for suicide prevention in addition to the other resources through our blog, but there is help out there. Things will change and get better. So our job is to survive it now so that we can be there to see things get better. So thank you so much. I hope that you found something useful in this, and hopefully we'll have more to share with you for Mental Health Awareness Month. Okay, thank you.